We're going to have a discussion focusing on MDS and anemia in lower risk MDS. I am Hana Safah, Professor of Clinical Medicine at Tulane School of Medicine, as well as the Director of Stem Cell Transplant and the Heme Malignancy Program at Tulane. Joining me are my colleagues.
Hi, I'm Jamile Shammo. I'm Professor of Medicine and Director of Bone Marrow Failure Program at Northwestern University.
Hi, I'm Andrew Brunner. I'm an assistant professor at Massachusetts General Hospital and Harvard Medical School in Boston, Massachusetts.
Hi, I'm Tiffany Tanaka. I'm an associate professor for the Division of Blood and Marrow Transplant at UC San Diego Moores Cancer Center.
This is what I'm going to have Tiffany talk to us about Luspatercept modulating inflammatory reactions. So I think that's how we're evolving in understanding the disease. Yes.
Yeah, I thought this was a really satisfying abstract. It's always nice to see some biologic or biomarker study that really translates clinically. So this abstract looked at the erythroid precursors as well as the inflammatory molecule pathways and compared the Luspatercept to the Epo arms. And what they found is that the erythroid precursors and the reticulocyte count that actually was higher in the Luspatercept arm when compared to the erythropoietin arm. And this was durable too, it was up to that 48-week mark. So clinically, that makes a lot of sense. You would expect that the Luspatercept drug would actually prompt more effective erythropoiesis. And then what you mentioned too was the inflammation was turned down. So this was done by RNA sequencing, and they found that a lot of the pathways we expect, interferon, IL-1B, IL-10, et cetera, those were all downregulated in the Luspatercept arm compared to the Epo arm. So just as you mentioned, maybe that really makes people feel better too, reduction of the inflammation, and that changes the bone marrow microenvironment and helps promote normal red blood cell maturation.
That's perfect. And the interesting part to me in that abstract was looking at the BMP. That is to me, because we know patients with CHIP who might have the same mutations that we see with MDS end up with more cardiovascular disease, right? So maybe there is some connection there, and having decrease in the BMP in these patients, is it just because we decrease the transfusion burden, or are we doing something different in these patients with certain mutations? I'm loving this era because now it's not just MDS, right? It's something else we're doing to the disease. So thank you for sharing that with me. So when we look at all these abstracts, as I said, we're hearing sound bites that were not there before, right? Quality of life. And we're hoping all that it becomes an endpoint that is studied in clinical trial because it's very important to these patients to know, is it just what we're doing or is it something to do with the biology of the disease and how they're feeling from that.